My name is DERMABOND and I am married to the love of my life. We've been married for 44 years. We have been together for 50 years. We have been living in Virginia Beach for close to 17 years now. I am getting ready to have a total knee replacement and looking very much forward to it. I'm having the surgery because I really want the quality of life back. Having a bad knee and having it to the point that it is right now it's immobilizing. Family is very important to us. We spend a lot of time together with all of our children and with grandchildren.
She's very independent, doesn't want to be a drag on anybody.
I can't get down on the floor and crawl with my granddaughter. I actually even have to be very careful about how I carry her. I worry about falling. I expect to be able to sleep and be able to be mobile again, being able to do the normal things that people get to do.
Ms. McGaw is on the younger end of the spectrum for our patients. Very active, very dynamic individual. She's really plugged into the issues.
One of the earlier surgeries when I was in my 20s was an abdominal surgery, and I did get an infection from a suture. I kept having to go back to the doctor, more medicine, and it was very uncomfortable. Having an incision with sutures and Band-Aids it's messy, and you have to be very careful when you shower and clean it.
Wound closure is very important to the concept of hip and knee replacement. It's our final barrier to the outside world from that beautiful set of implants that we just put in the joint we reconstructed. In the evolution of our wound closure, we were really quite pleased when we moved from staples to the topical skin adhesive DERMABOND. Patients are going home earlier than they ever have before. Our average knee replacement patient will go home on the second day. They can shower the next day. They really like that aspect. And then we realized that we got really good looking cosmetic wounds that patients were talking about. A couple months later, you could barely see their incision.
The first time I heard about DERMABOND PRINEO was when I was at my last doctor's appointment prior to surgery a couple of weeks ago.
I met with Ms. McGaw at a pre-op and told her that we're going to use DERMABOND PRINEO 22 for her closure, and I reassured her that this is something we've been using for quite a long time since it came out, and we're very happy with the results. They don't have to worry about changing the dressing. It's not leaking. With staples it would leak and they would snag on things and people would feel pain, and with the DERMABOND PRINEO 22 they're happier that they can shower, and they're happy that they don't have to worry about doing anything, just wait till it falls off.
It is time. It is definitely time. Not having the sutures, being able to shower, being able to not worry about infection, that takes a lot of the pressure off of worrying about some of the other things that you can concentrate on doing your therapy.
All right, first day, morning after. Hey, morning. How we doing?
Great.
Yeah? Mind if we, Surgery part was uncomplicated, knee replacement that went well. This morning, looks like a star. Sitting in the chair, her hair's done, her makeup's on, she's in street clothes. We'll take her dressing off today. She'll be in shorts this afternoon and tennis shoes down in physical therapy.
Well, I'm really excited about, once this comes off, that clear bandage, the DERMABOND PRINEO, that's going to be, I love the idea that I'll be able to see my incision. I love that.
She can look at her incision, beautiful, nice little straight incision, glued shut, doesn't need a dressing.
All right, your first exercise is going to be ankle pumps. You're going to do 20 on both feet.
She can shower in 72 hours after her knee replacement. That's made a positive psychological effect, I think, on patients, seeing themselves as closer to normal and getting better quicker.
Look at that.
All right, that looks great. So
Doesn't it look awesome?
That's the glue and tape I was telling you about.
Okay.
This is going to take about 4 to 5 weeks before it falls off.
Okay.
So if it starts to peel down, just trim it.
It's just amazing the difference of what another
incision would look like when I've had other surgeries. Looks great.
All right.
Oh, thank you so much. Yeah, it did really good. I'm excited to be able to go home and shower. That's huge.
Diane is doing extremely well. She is really breezing through the PT. In fact, I believe they tell us she's ahead of schedule. And from her regard, being able to take care of herself, be independent as fast as possible was huge.
I'm back to driving. I'm getting around and doing most everything, and just have to learn to be patient that I'm doing great after 6 weeks.
How's it going?
Great!
No cane, no walker, no nothing?
Nothing, nope.
How's it been?
After the DERMABOND PRINEO came off, it was wonderful. I was so anxious to see actually the scar line, which is it's such a fine scar line versus when you have sutures.
Here on, it's just kind of graduating back to your active lifestyle in a slow, gradual fashion.
Just even in the last few days, I feel like I've had improvement. The more I do actually, even though I pay for it at night, the better I am the next day.
People get moving and see their knee coming around and get their gait back, and then they start to see the light at the end of the tunnel. Generally, week to week or month to month from here on in, it just keeps getting better.
Summer here in Virginia Beach is amazing. I'm looking so forward to be able to entertain and have my family in and go to the beach with them and do all the fun things that you can do, which I've not been able to do. I can't wait.